All right, joining us via Skype from Abuja is Dr. Obinna Ebirim, a public health and health promotion specialist. Good morning, and thank you for joining us on TVC Breakfast. Now, quickly talk to us. WHO has declared this a public health emergency. Talk to us what this means.
Good morning. It means that this disease has now occurred to a level that it's of concern that then the WHO needs to begin to employ some of the standards as articulated in International Health Regulation 2005. So if you listen to that press brief by the WHO yesterday, it said that now it can begin to question countries and how they respond to this outbreak. So said that some of the countries have done some questionable things, like the way they've restricted trade, they've restricted movement into their country. So with this declaration, WHO then will have that more powers to take up some of the leadership and governance role in the terms of the global management of this outbreak. So that is the implication. It shows that now this disease is at a scale that it's of international concern, and WHO is now empowered to begin to play some of its health governance role as it relates to the management of this disease.
All right, looking at the fact that this disease has been declared by the WHO, some countries have taken the initiative beforehand to close its borders to China. Of course, airports, the seaport, and the land borders. Is this the way to go in curbing this situation?
So, based on the WHO rules and regulation, that is not totally the way to go, because if you listen to the speech of the WHO chief yesterday, he said that this is not a time for isolation, but a time of solidarity, and that it's not a time for fear, but facts. So what is important is, what are you doing things according to the right thing? So I think that it's not a time, it hasn't gotten to the scale where you have to close your border for trade, but what you need to do is to make sure that in country you're prepared. You see, yesterday when WHO declared that this disease as a public health emergency of international concern, there was something critical that the WHO chief said. He said that we're not declaring this because of the number of cases or because of the response by China, but it's because of some countries with weaker health system. So I think that what needs to be done is to be prepared in country. That preparedness, what needs to be done, some of those preparedness processes is people coming to your country are first interviewed.
All right, Dr. Ebirim, so what would be a balanced approach to addressing this globally before we come to Nigeria?
So globally, what is being done is the right thing. The WHO has taken ownership. It's sending up in advisory. The right research have started to find out a possible cure, a possible vaccine. Countries are cooperating and sharing data. Countries are protecting other countries by making sure that if they are affected, then they manage people coming from their country to other countries that are not affected. So the global approach, I think it's very right. Countries are cooperating and doing what they need to do to protect themselves and protect other countries. So that which is being done globally is the right thing. And we are happy that now it's the world is taking it very serious by having declared it a disease of public health emergency of international concern. So that is what needs to be done, and it's being done at this moment.
All right, Dr. Obinna Ebirim, we'll leave the discussion at this point. Thank you for speaking with us. Well, joining us via Skype from Abuja is Dr. Obinna Ebirim, a public health and health promotion specialist. Good morning. Thank you for joining us on TVC Breakfast. When you look at, when you assess efforts being put in place by Nigeria, also talking about having special funding for the National Center for Disease Control. Would you say this is proactive enough at tackling this issue head on?
Yeah, so based on the advice and recommendation by WHO, especially yesterday when the DG declared this disease a public health emergency of international concern, I think that we are doing the right thing by ensuring that everyone who gets into this country is properly interviewed to find out about their travel history. The Minister of Health in his last briefing recommended that those who are coming from affected areas self-isolate themselves for 14 days to ensure that they do not have this disease before making them joining the public. So I think that we need to continue to do this to ensure that we do not get this disease into the country.
All right, do you think as a country we are equipped or ready enough to handle this?
So I can't say that we are totally equipped and prepared. Recall that one of the reasons why this disease was declared a public health emergency of international concern, it's because of countries with weaker health system. Our health system is not that strong to deal with such disease, but it is not a time to cry and over spilled milk. What we need to do is to be prepared to strengthen some parts of our health system. The WHO has recommended that countries now begin to invest in disease preparedness.
So when you talk about investing in our public health systems, are you saying that we should go the way of China to start building hospitals now? Or what exactly are you saying?
So what we need to do is do we have the right tools, the PPEs to protect our workforce? Our workforce adequately trained and have the capacity to prevent diseases? Do we have our people? Do we have that health awareness to do the right thing to prevent disease spread? I think that we need to look at the pillars of the health system. Not just the infrastructure. We have hospitals, but these hospitals are they well equipped? Do we have adequate manpower? The workforce, are they well trained? Do we finance our health system to the point whereby we keep our best and not allow them move out of this country? So this that's about the health financing. So we need to look at the pillars of the health system holistically and not just about infrastructure. It's not about building beautiful hospitals that are empty, that do not have the right equipment, do not have the right workforce. So these are the things we need to do. We need to make sure that we have isolation centers in these hospitals, and we have the right equipment to deal with disease of this such.
Now that you talked about isolation centers in hospitals, we remember the case of the Ebola virus, and we did not have isolation centers, just makeshift centers that was converted. But at this point now, are you concerned about this situation, about the fact that our hospitals do not have centers that could cater for such outbreaks so that we could handle it head on?
I like this point you've made. I think that we shouldn't always be reactive. We should be proactive. So I think that these outbreaks are a lesson to us that we need to get prepared. We need to make sure that our hospitals have the standard sections, so an isolation ward, areas, the right tools. So yes, I agree with you. We need to be prepared. We shouldn't just only react when such happen. We should prepare to say, okay, if we have such outbreaks, we are prepared to take care of patients. Our port health authorities are ready to deal with it. Let's not just only be reactive. Let's be proactive in issues of health.
All right, Dr. Obinna Ibirim, thank you for speaking with us.